Imagine you walk into a hospital in America with a broken arm. Nothing complicated, just a fracture. You get an X-ray, a cast, maybe some painkillers. You're out in a few hours. Then the bill arrives. 45,000 ringgit. For a broken arm. No surgery. No overnight stay. Just a cast. Now imagine the exact same treatment, same quality, same equipment, happening right here in Malaysia for less than 2,000 ringgit. Same arm, same cast, same result. That number gap isn't a typo. And today you're going to find out exactly why that gap exists, who benefits from it, and why Malaysia's healthcare system is quietly doing something that the most powerful country in the world has completely failed to do. Before we go further, I want to ask you something. If you're watching this right now, help me settle a debate. My friend from KL kept telling me that Malaysians don't care about topics like this, that only political drama gets views, that nobody wants to hear about healthcare economics. I think he's wrong. I think Malaysians are smart, curious people who want to understand the world around them. If you agree, just hit subscribe and prove him wrong with me. Let's show that we care about things that actually matter. Assalamu alaikum, and welcome back. Let's start with some context, because this comparison only makes sense when you understand the numbers. The United States spends around 4.5 trillion US dollars every year on healthcare. That's roughly 18% of their entire economy. Per person, that's about 13,000 US dollars annually, which converts to nearly 60,000 ringgit per American, every single year, just on healthcare. Malaysia? We spend around 1,800 US dollars per person per year. So America spends roughly 7 times more per person. And here's the part that should make you raise an eyebrow. Americans are not 7 times healthier. In fact, by several key measurements, Malaysians live comparable lives, and in some areas, Malaysia actually performs better relative to what we spend. That's the mystery we're unraveling today. Let's talk about what healthcare actually costs here versus there, because the specific numbers are where this story gets genuinely shocking. A standard consultation at a government clinic in Malaysia costs between 1 and 5 ringgit for citizens. Yes, 1 ringgit. That's the price of a roti canai. In America, a basic doctor's visit without insurance can cost anywhere from 150 to 300 US dollars, which is 700 to 400 ringgit, for one appointment, without any treatment. Just for someone to listen to your chest and say, "You're fine, drink more water." An MRI scan in the United States averages around 2,600 US dollars. In Malaysia, the same scan at a private hospital runs between 800 and 1,500 ringgit. That's not a small difference. That's the difference between a life-changing debt and an inconvenient Tuesday. But here's the thing most people don't ask. Why? Why is it so dramatically different? Is Malaysian healthcare somehow inferior? Are we cutting corners? Or is something else entirely going on? The answer starts in 1969. That's when Malaysia committed seriously to building a public healthcare infrastructure that was designed to serve everyone, not just people who could afford it. The government made a deliberate choice early on to keep healthcare as a public good, not a commercial product. That philosophy shaped everything that came after. Government hospitals today are heavily subsidized. A Malaysian citizen can go through a heart bypass operation at a government hospital and pay somewhere between 1,000 and 6,000 ringgit depending on ward class. The same procedure in the US averages around 150,000 US dollars. That's 700,000 ringgit. For ones, sound familiar? You've probably heard someone in your family say, "Pergi hospital kerajaan je, murah," and you might have assumed that means lower quality. But think about this. Hospital Kuala Lumpur, Hospital University Malaya, Hospital Selayang. These are not small, underfunded clinics. They're training grounds for doctors. They handle complex surgeries daily, and they operate under genuine medical standards. The price difference isn't about quality. It's about who is absorbing the cost. In Malaysia, the government absorbs it. The taxpayer contributes, and in return, the system is accessible. This is what economists call a cross-subsidy model. People who pay taxes fund a system that everyone, including the poorest, can access. It's not perfect. The queues are long. The facilities can be stretched. But the fundamental architecture protects people from financial ruin when they get sick. Now let's talk about America, because understanding their system makes ours look even more extraordinary. The American system is built around private insurance. And this sounds reasonable until you follow the money. In America, there are companies whose entire business model is to collect your monthly premium and then find reasons not to pay when you actually need care. These insurance companies employ thousands of people whose job is to deny claims. That's a real job. Claim denial. And those salaries, those corporate profits, those executive bonuses, they all get baked into the final bill that patients pay. An American hospital doesn't just charge you for the doctor and the medicine. They charge you for the entire administrative machinery that surrounds the system. Studies have found that administrative costs account for around 34% of total U.S. healthcare spending. Malaysia? Our administrative overhead is a fraction of that. Here's a micro-story that puts this in human terms. Imagine a young engineer in Petaling Jaya. Call him Hafiz. He wakes up one morning with chest pain. He goes to the emergency room at Hospital Kuala Lumpur. He gets an ECG, blood tests, a doctor consultation. He's kept for observation for 6 hours. He goes home. He gets the bill. Maybe 150 ringgit. He pays it and goes back to work the next week slightly humbled, but financially intact. Now imagine his counterpart in Houston, Texas. Same age, same chest pain, same tests. 6 hours of observation. He goes home. The bill arrives 3 weeks later. 12,000 US dollars. Even with insurance, his deductible means he owes 3,000 out of pocket. He had 800 in savings. He now has medical debt. Medical debt that will follow him for years, affect his credit score, and statistically increase his chances of avoiding future medical care because he's terrified of another bill. That fear literally makes people sicker. There are studies on this. In the U.S., people delay going to the doctor because they're afraid of the cost. Conditions that could be caught early become emergencies. Emergencies that could be treated cheaply become catastrophic events. This is where Malaysia's system protects people in ways we don't even realize. But wait until you hear what happens when you look at medical tourism, because this is where Malaysia's healthcare story becomes globally significant. Malaysia is one of the top medical tourism destinations in the world. In 2019, before the pandemic disrupted travel patterns, Malaysia received over 1.2 million medical tourists. These are people who got on planes, flew to Malaysia, received treatment, stayed in a hotel, and still paid less than they would have at home. Indonesians come for cardiology. Bangladeshis come for orthopedic surgery. And yes, increasingly, Americans and Europeans come specifically to avoid their own. Think about what that means for a second. Someone in a first-world country with supposedly advanced healthcare is flying 20 hours to Malaysia because it's more affordable here. That's not a compliment to Malaysia's cheapness. That's an indictment of their system's failure. Private hospitals in Malaysia like Gleneagles, Pantai, and KPJ have understood this opportunity. They offer international standard facilities, English-speaking doctors, many of whom trained in the UK, Australia, or Ireland, and pricing that undercuts Western hospitals dramatically, even with full profit margins built in. A knee replacement that costs 40,000 US dollars in California costs around 12,000 US dollars in Kuala Lumpur at a private hospital. And that includes accommodation, aftercare, and sometimes the flight. Now let me close a loop I opened at the beginning because I promised to tell you who benefits from the American system being broken. The answer is the system itself. Pharmaceutical companies in America can charge whatever they want for drugs. There's no price cap. Insulin, which has existed since the 1920s and costs around $10 to manufacture, was being sold for over $300 per vial in America just a few years ago. The same insulin. In Malaysia, it's available for a fraction of that price. The reason is simple. Malaysia, like most countries, negotiates drug prices at the national level. America largely doesn't, because the pharmaceutical lobby spends hundreds of millions of dollars ensuring that doesn't happen. Insurance companies lobby against reform. Hospital networks lobby against price transparency. The entire machinery of American healthcare has a financial incentive to stay expensive. And this is where it gets really interesting, because Malaysia is not just accidentally cheaper. Some of this is the result of deliberate policy choices, careful management, and yes, political will to treat healthcare as a right rather than a revenue stream. That doesn't mean our system has no problems. It does. Public hospitals are overwhelmed. Wait times can be brutal. Rural access is still uneven. Brain drain takes some of our best doctors abroad. These are real challenges. But the fundamental structure, the idea that you will not go bankrupt because you got sick, that a mother can bring her child to a doctor without first calculating if she can afford the consultation, that someone earning minimum wage has access to the same emergency room as someone earning 10 times more. That structure is something millions of Americans would genuinely cry for. Here's what you take away from all of this. Malaysia built something valuable, and most of us walk past it every day without noticing. The ringgit clinic visit, the subsidized medication, the government hospital that asks about your condition before asking about your payment method. These are not small things. America's system spends more money per person than any other country on earth, and still leaves tens of millions uninsured or underinsured. Malaysia spends a fraction of that, and covers the vast majority of its population with basic access. That gap is not a coincidence. It is a choice. Two different countries made two very different choices about what healthcare is for. So the next time someone dismisses Malaysian healthcare, the next time you hear complaints about the long queues at Hospital Kuala Lumpur, just remember what the alternative looks like. Remember Hafiz and his 150 ringgit bill. Remember the American engineer drowning in debt for the same 6 hours of care. If this made you think differently about something you've taken for granted, share it with someone who needs to hear it. Subscribe if you want more of this kind of honest, grounded look at the world through a Malaysian lens. And drop a comment below telling me what part of this surprised you most. Because we deserve to understand the systems that shape our lives. And you just proved that by watching until the end.